Hi, Bob Lightfoot here, and I have another update for you. There was a special assisted living forum on June 28th, and I wanted to provide you with a synopsis of that forum, which went on for 2 hours. It covered briefly testing, but for the most part covered visitation. The DHS website guidance on visitation has been updated as of June 14th. So I wanted to give you the information so that you can review it and implement it in your facilities so that you're in conformance with the most current guidance. As we know, things have changed a lot, and I haven't updated you because there really hasn't been much change in the guidance, but now it has changed, so I've got another video here for you to get through some of this information. First, on testing, you should still be routinely testing unvaccinated especially, and what you want to do is look at the county positivity rate, and then it depends on the size of your facility. Now, this guidance is mostly for assisted living, although during the presentation at the assisted living forum, they did say that some of this would be applicable to nursing homes as well, but for right now it's under the safer visitation in assisted living. And the way you get to that is you just Google DHS safer visits in assisted living, and then just scroll down and you'll find that guidance. With the testing, as I said, if you're a small CBRF, which is 9 or less, or an adult family home, you should be testing unvaccinated staff and residents routinely based on the county positivity rate. For large CBRFs and RCACs, you can only test unvaccinated staff is really all you need to test. And the rates there are, if it's less than 5% county positivity rate, you should test monthly. If it's 5 to 9% county positivity rate, test weekly. And if it's more than 10%, test twice a week. And obviously, if someone has COVID symptoms, a staff or a resident, you want to test as you normally would. And you should also be screening people as they come into the facility, and that's important for visitation. So let's move on to visitation. First, a couple of things before we get into it. They still want us using masks in healthcare facilities. It's not like going to Walmart where now they've lifted that. These are healthcare facilities. Things are still transmissible. They're seeing an uptick, especially in respiratory illness, non-COVID respiratory illness, so masks are important. Personally, I've enjoyed not being sick for the last 18 months, so I'm still using a mask in certain situations. And the other thing is they want you to use surgical masks. The cloth masks, they're really not in favor of. It's only kind of as a last resort. I mean, you can get those surgical masks very cheap just about anywhere. Amazon, I've seen them, and everywhere else. So that's what they want you to use. And remember, standard precautions are still always in effect. I mean, the idea that you treat everyone as though they're infected, that's still the standard. You should not be deviating from that. Okay, so let's get into it. So if you go to the DHS web page and get under the safer visits in assisted living, this follows CDC guidance, and the first idea is that facilities should limit the indoor visitation for unvaccinated residents if the county's positivity rate is greater than 10% and less than 70% of the residents are fully vaccinated. Second is residents with confirmed COVID-19, whether vaccinated or unvaccinated, until they've met the criteria to discontinue transmission-based precautions, visitation should be limited. And this is common sense stuff. Residents in quarantine, whether vaccinated or unvaccinated, until they've met the criteria to be released from quarantine. So you should limit visitation in that instance. If there's an outbreak, obviously, or if an outbreak is limited to a single unit or floor, you can allow visitation to the unaffected unit. But if there's an outbreak, you really should be pretty much limiting visitation. Location of visitation if occurring indoors. So they still want you to have a designated area or limit it to the resident room. And if the in-room visitation must occur and there's an unvaccinated roommate, that roommate should not be present during the visit. If neither resident is able to leave the room, then the facility should attempt to enable an in-room visitation while maintaining recommended infection control prevention and control practices, including physical distancing and source control. Now, source control is their new buzzword for masking. I don't know why they don't just say use of mask, but it's now called source control. Source control, as I see it in their definition, does not refer to goggles or face shields or anything else like gowns, just masks. And so they do want you to practice physical distancing and source control, and that should continue. Then, physical distancing and source control recommendations when both the resident and all the visitors are fully vaccinated. So you can see they're breaking this down into unvaccinated and vaccinated. So when visitors are alone in the residence room or a designated area, the residents and the visitors can choose to have close contact, including hugging and touching, and not wearing source control, not wearing masks. Visitors should wear masks and physically distance from other healthcare personnel and residents or visitors that are not part of their group at all other times while in the facilities. So now let's move on to not fully vaccinated. It says physical distancing and source control recommendations for visitors and the resident who are not fully vaccinated. The safest approach is for everyone to maintain physical distancing and to wear masks. However, if the resident's fully vaccinated, they can choose to have close contact, including touch, with unvaccinated visitors if they both continue to wear well-fitting source control, well-fitting masks. Visitors should wear masks and physically distance from other healthcare personnel and other residents and visitors that are not part of the group at all times when in the facilities. Facilities should regularly monitor local disease activity, so those county positivity rates, but that should not be the sole factor. Then there's definitions, additional definitions, and additional factors to consider. So continue to screen all those who enter. So continue doing your COVID screening. Educate visitors and residents on hand hygiene both before and after visits. Monitor the visitors to make sure they're wearing masks when that is appropriate. Now, I don't know how you enforce that because I asked that question at the forum, and they, I believe, purposely did not answer that because they did not want to answer that. And I specifically asked, in conjunction with being cited by a surveyor, if there are visitors not wearing masks in, say, the hallways or whatever. And so they didn't answer it, but they do want you to monitor it. High-touch areas should be frequently cleaned and disinfected. Ensure that staff use PPE at appropriate times. Cohort residents as needed, and conduct resident and staff testing as has already been recommended. Visits should occur according to the needs and wishes of the residents, so that's still in place, as the Ombudsman had spoken about during the pandemic. The capacity of the room and the area should be considered when multiple visits are occurring. Facilities should be careful with privacy. One of the things they brought up, and I'll move on to that, is communal activities. So what are the recommendations about communal activities? Vaccinated and unvaccinated residents who are in isolation should not be participating. Vaccinated and unvaccinated residents in quarantine should not be participating. But determining whether an activity can occur is going to be on the facility and how that is conducted. Again, vaccination status should be considered. If all residents attending are fully vaccinated, then they can choose to have close contact and not wear masks. The healthcare providers and healthcare personnel should continue to wear masks and PPE as recommended during the activity, regardless of their vaccination status. If unvaccinated residents are present at an activity, then all the participants should wear masks. Any unvaccinated residents should physically distance. Now here you get into a little bit of, I think, a little HIPAA issue. If we're going to have 6 people in an activity and one is unvaccinated, and you've got 5 people close together, and you insist that the 6th unvaccinated resident is 6 to 10 feet away, I think you've sort of set them out and sort of made it aware to the world, everybody else in the facility, that that's unvaccinated resident, and is that a HIPAA violation? I think it could be. You're going to have to be careful how you single out unvaccinated residents. They obviously have the right to not be vaccinated, and hopefully this won't be a huge issue, but just be sensitive to that issue, that you don't want to make it so obvious that someone's unvaccinated, because you could get into issues there. With dining, fully vaccinated residents can participate in communal dining without source control or physical distancing when all residents there are fully vaccinated. If unvaccinated residents are in a communal area, all residents should use face masks when not eating, and unvaccinated residents should continue to remain physically distanced from others. So again, here you have a little bit of an issue. With regard to healthcare personnel, even fully vaccinated healthcare workers should continue to wear masks at work. However, fully vaccinated healthcare staff can dine and socialize together in break rooms in staff-only spaces without masks. So if you have fully vaccinated staff, they can be together in staff-only places without masks. Otherwise, masks should be indicated. So that's the guidance for the most part that came out on Tuesday. Again, remember, this is on the DHS website, and I Googled it and I found it quite easily. There is also learning modules that you can review, and I simply Googled DHS long-term care webinar, and it came right up. So I hope that's helped you out some, and if you have any questions, as always, feel free to give me a call at my office or email me, and we can talk through your situation. So have a good day. Hope you're all still doing well.